Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752. That's 866-870-5752. Call in today. You get Dr. Darrow's latest book for free, and it's chock full of research. It is actually called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with actually 264 studies. And remember, we are here at 10 a.m. on Saturdays and at 1 p.m. And right now we're going to go talk to David in West LA.
David, Dr. Marc Darrow, how are you today?
Hello, doctor.
Yes, sir.
Hello, doctor. About roughly 4 months ago, for lack of a better term, I had a shoulder rebuilt. The ball was replaced. And I was sent to a rehab hospital shortly thereafter, and they did absolutely no physical therapy on me ever since. And as a result, I have what I would call a virtually paralyzed right arm. I do receive physical therapy currently, but it sure doesn't do the job. I would assume that your treatment would do the job for me.
Well, you're a little bit too late, David, because the problem is this. My treatments are biological, and your treatment that you had was putting in metal and plastic, it sounds like. You probably had a reverse shoulder replacement. And unfortunately, I feel terrible for you. I mean, this is the worst thing that can happen, but I see it commonly. And the last one was a friend who ended up with a staph infection and had to stay in the hospital for months just to clear that up. I do not like these surgeries. There was one man that came in the office, and he had pain in his right shoulder, and I examined him and I said, I can help you with this. And then I said, what about your other shoulder? I have to examine that. He says, don't waste your time. I had a shoulder replacement and the parts don't fit together, and I can't move my left arm at all. So I'm not going to say it's common that this happens, but it does happen. And most of the people that I get who say their doctor says they need to have a shoulder surgery or a shoulder replacement, we can usually help them without doing that. We can usually just inject platelets mixed with stem cells from their own blood or from umbilical cord and get them healed up. We might not fix them 100%, but we get them so they're happy. And unfortunately,
what I was hoping for is that your treatment would maybe give a lot of benefit to the surrounding tissue, to the plastic or whatever it is, inorganic ball. No?
Well, there's nothing that I can do around that area. I mean, if it's something unrelated and it's some of the tendons, then I could help you. But I'd have to see you and take a look what's going on to give you an idea. The chances are, if it is from that artificial joint they put in, then I can't help you. But a lot of times, I mean, the good news and the possibilities, David, are that a lot of times people come in and say, I have shoulder pain. It's not really their shoulder. It might be around their scapula in the back or their neck or something else that's close by, but not that. Can it?
For what it's worth, I have minimal pain. It's just use of the right arm. Does that mean anything?
Not really. I'd have to see where the difficulty is by touching it.
I see. Well, I have questions about my medical insurance validity.
Well, here's what you do.
I would like to take your phone
for the questions about your medical insurance. You know, I mentioned this before in the first half hour of the show. We do take Medicare, Cigna, Aetna, Blue Cross, Blue Shield, United Healthcare, and if you don't have insurance, we can help you get a credit card that you don't pay any interest for the first year. But Even if we take, let's say we take Medicare, and let's say you are a Medicare patient, you may have put that through an HMO that we don't take. So you have to call the office and find out, and they'll do an insurance verification.
Yeah, but I have to confirm through the insurance
No,
company
we'll do it for you.
that I'm good.
No.
That's what must
Yeah,
be
David,
done.
you cut me off. What I'm trying to tell you is that if you call the office, they'll call the insurance company for you to find out what's going on. You're not going to be able to do a good job calling your insurance company to find out. It's very confusing. Insurance is confusing. I suggest you call 800-300-9300. 800-300-9300. That's our
Alrighty.
office. Someone will talk to you. If the lines are busy, just leave your number. They'll get back to you. And they will check out your insurance for you. It's very, very complex. People come in all the time and they say, Dr. Darrow, you take my insurance. I called up and I talked to my staff and they say, well, we take the name of that insurance, but that particular insurance policy is HMO and we don't take that. So you got to call in to find out what's really going on if we take your insurance.
I thank you very much for your time
God
and
bless
trouble.
you, David. I'm glad there's very little pain with it. And hopefully there's something we can do to get your range of motion back. I have no idea until I touch the area.
Thank you
God
very
bless you,
much.
David.
Thank
Good
you,
luck with
David.
that.
Hope you feel
You've been
better.
a great help,
I hope
Dr. Darrow.
so.
Thank you.
Okay, that's awesome. 866-870-5752 is our number right here, right now. And we have some time left for you. You can still get in queue. And guess what? Lines are open just for you. 866-870-5752. And we are going to Joe.
Hey, Joe, Dr. Marc Darrow.
How are
I'm
you
living
today?
it up. You have pain down both your legs.
Yeah, I have some sciatica pain, radiating down both legs, but on the left side it goes down into the
Okay.
calf.
And how about on the right side?
And I was wondering if there's on the right side, just below the buttock, into the
Okay.
side.
So, you know, this sounds crazy, but I like to talk about crazy stuff and open people's minds up. A lot of patients come in, they say they have sciatica, and I examine them, I go, you don't have sciatica.
Okay, well, I was just using that as a definition of the pain I was
Yeah,
feeling.
no, I'm glad. I'm
That's
glad you're
okay.
using that because that's how people relate to pain down the legs. But for you, it's different. You know, in your left leg, it goes all the way down to your calf, and your right leg, it just goes down the butt to your hamstring. And a lot of that kind of stuff might just be a hamstring tendonitis where it inserts on the ischial tuberosity. So again, like everybody else that I talk to, I have to touch the area to see what's really going on. Did you get an MRI, Joe?
I haven't had one in
Okay.
years.
So that'd be a good case to get an MRI and maybe an EMG and a nerve conduction study to see what's really going on. But the most important thing is for me to touch your back and your the butt area and the hamstring area and the leg area to see if any of it is just local pain and not being referred from a nerve.
Okay, that sounds
Yeah.
good. Right. And I listened to you when you told the other people to call. I'll call the office, make an appointment, let them know what insurance I'm working with, and see what we can do.
Sounds good, man. The number to the office for other people is 800-300-9300. And if you just want to watch me do these procedures, I have videos online on my website, which is www.lastemcells.com. That's lastemcells.com. The videos don't cover the entire body. I do inject just about every millimeter of the body, depending what's going on. But they cover the main areas that people call in and complain about. So Joe, good. God bless you. I'm hoping it's not a real sciatica and it's just some local pain that's happening. Sciatica typically is one.
Well, I'm hoping that also,
All right.
Doctor. Thank you for
All right,
being
God
there
bless
for
you,
us.
Joe. So before,
Thank you, Joe. We
before
appreciate
you
your
move
call.
on, Nita,
All right.
I'd like to,
Yes.
number one, give out the, we do have 15 minutes left, and I want to get callers
Yes.
in here. So 866-870-5752. If you're driving, grab a pen. I'm going to repeat it now. 866-870-5752. We're looking for your calls right now. And then I want to just discuss a couple of other things. My wife, Michelle Darrow, does the vampire facelift. She does aesthetics, which makes people pretty. And she injects the same cells from the body that I use on the body. She does it on the face to grow the collagen and make people look a lot better. And she also does it on the head to grow hair. And there's a lot of studies on this coming out that show that yes, we can grow hair on the head. And for those of you that are overweight and you have lower extremity pain, I'm going to ask you to please go on a diet. Don't punch me in the face when I ask that. Some people, as soon as I mention diet, they start grumbling and getting really angry because they fought with that their whole life. We have a diet called Ideal Protein that works on every single person who does it. And if you want to gain your weight back after I heal you up, go ahead. But while I'm working on you, I want you to lose the weight so that we can get a better result. Every pound on the tummy that's in excess is 4 pounds on your knee. If you're 50 pounds overweight, which is pretty common these days, that's 200 pounds on your knee. That's crazy. That 200 pounds on the knee is going to wear it out and cause osteoarthritis. There are studies on that. Every pound you can get rid of. And this is a funny thing. A lot of people go, well, I don't want to lose all that weight because I won't look good. My face will be wrinkly. Yeah,
What?
no, I hear it all the time. I hear every
What?
excuse in the world. The common excuses are, you don't know what my life is like. Another excuse, you don't know what my father treated me like. You know, I get these things, and I understand life.
The historical excuse.
The historical, thank you, that's a good way to define it. And yeah, I get it. We've all had tough lives, and some more than others. But now is the time to be happy. And you don't bring your history in to confuse it. So I don't care if you've been fat for 50 years. We can get you skinny really, really quick. We drop about 15 to 20 pounds off of people in a month. That's pretty good. If you have 15 or 20 pounds, let's pretend 20 pounds extra, which is really common. 20 times 4 is 80 extra pounds on your knee. That causes your arthritis. We got to get the weight off. Now I tell people to tell me to shut up when I talk about diet if they want me to. They don't have to lose the weight. It's just going to make them feel a lot better a lot sooner. And I like that for a lot of reasons. I like happy people. I like happy patients. And I like when people like me. And you're going to like me a lot better if you heal faster. You're going to send me a lot of referrals if you heal up, believe me. So
Amazing. So our number is 866-870-5752. Get on board. There's time left and lines open for you right here, right now. And shall we go to Joe in Huntington Beach?
Yes. So Joe, you have a friend who has knee pain. The doctors want to amputate. Why do they want to amputate?
Well, they're surgeons. And how do surgeons make money? By doing surgery. I've been trying to tell her she's a grandmother. She takes care of her granddaughters. I've been trying to tell her for 2 or 3 years about you. And I wonder if you think it's her knee, and she's been on crutches, and the surgeons haven't been able to heal it. And I wonder if you think if I get her to come for an appointment, you could do the blood platelets in her knee and save her leg.
Well, I'm not. When you say amputate, you're talking about just cutting off the end of the bones and putting in a prosthesis called a knee replacement. Is that what you mean? Or are you talking about actually amputation of the whole leg?
Well, I'm not certain. I know some people here where I live in Leisure World who've had the knee prosthesis. Put in. One lady, she can barely walk. but I'm not certain if that's just the bone thing or
Okay.
they
Well,
want
either
take
way,
the whole
there's
leg.
a good chance if she can move her knee that I can help her get better.
Yeah, good. I'm Facebook friends with her, and your office is up. I'm willing to come with her to.
Well, you're
your
a sweet
office.
man. We're right off of
UCLA.
right off of the 405 on Wilshire Boulevard, across the freeway from UCLA.
Yeah, I used to go to UCLA, and I know the federal building.
Yeah, federal
is there.
building we're close to also.
And you have not only your medical degree, but you have your law degree too, don't you?
Don't tell anybody. Yeah,
Dr. Darrow, this is the radio, just let you know.
Yeah, I practiced law 15 years before I was before I went to medical school.
Yeah, I bet you the medical the surgeons give you a hard time.
They give me a real hard time. Yes, it used to be a lot worse because I was basically the big gun in LA doing regenerative medicine. So yeah, the surgeons really badmouthed me a lot. Today it's not as bad. Now they don't blame me anymore, but they just say this can't work when their patients come in and tell them it worked. They say, well, it can't work. And even though the evidence is sitting right in front of them, but there's so much of this being done today that the surgeries are being backed off and the surgeons are learning how to do these regenerative procedures. So things are getting better, and I'm very happy that there's less surgeries being done, but there's still way too many being done that shouldn't be done.
Yeah, well, I'm going to email her because we're Facebook friends, right?
All right. Well,
right
I'd
away.
be very happy to talk to you, Joe. You can email me through the website, which is www.lastemcells.com, and I will respond to you immediately.
Yeah. Because I really love this lady. She's a grandmother, and she takes care of her granddaughters because their mom had some problems, and I've known her a long time, and I've seen the people here in Leisure World where they have the knee emplacement thing.
We want to stop that from happening. So we're going to move on to another caller. Joe, we appreciate you so much. You're a wonderful man.
Thank you, Joe.
And God bless you, my friend.
Thank you.
Thank you.
What you do, yeah. Mm-hmm.
Thank you so much, Joe. We appreciate your call, and I'm looking for your call at 866-870-5752, 866-870-5752. You get a free book, so call now. Steve in Long Beach.
Hey, Steve, Dr. Marc Darrow, I understand that you have a neuropathy. Is that correct?
Yes, and I just got a flyer. Somebody invited me to a seminar, and they're saying that the way to treat it now is with stem cells. And so I've heard you on the radio for a while, and I'm wondering your thoughts on that.
Whoa, how nice or how crabby should I be about that?
Middle of the road.
Okay, so first of all, I'm going to guess that flyer came from a chiropractor's office, because that's what they're doing.
Right, that's exactly
so
right.
They have no business in here.
Yes, it did.
They have no business involved with medicine. They're great at what they do. I love chiropractors. I go to chiropractors, but they shouldn't be, they shouldn't be involved in this part of the world of medicine. And what they do is they send out flyers to all over the place. They spend fortunes on having dinners that people show up or lunches at, and then they con people into doing stem cells for things that it doesn't work on. And neuropathy is not something that stem cells at this point should be advertised about. If the FDA, the Federal Drug Administration, gets on to these guys, they're going to shut their office down. So the FDA...
Wow, that's interesting. Well, he preaches fixing some of the same things that you do, and of course I don't have those issues, but this one I do. So it's good to know. You saved me a trip. I appreciate the information.
And look, I'm not.
Oops. Okay.
We got issues here. Are we good? we're back.
Yeah, we're going to thank you, Steve, for your
Steve,
call.
I'm sorry
think we had a little glitch there.
Because I have a lot more to talk about for you. But
yeah, so go ahead and talk to him. He's
okay.
listening.
So, Steve, I'm going to still give you more information about stem cells and neuropathy. Neuropathy, the two major causes we know of are diabetes and alcoholism. And there are a lot of what we call idiopathic neuropathies that we don't know what they're from. And a real neuropathy is basically a dying back of the nerves. And it starts in what we call a stocking glove distribution, bottom of the feet, and then it starts going up towards the ankles and then higher, or in the fingertips and then in the hands and up from there. And a lot of people come in, they say they have a neuropathy when it really is not a neuropathy. And I want to make sure that what I said before to you is not taken as a bash against chiropractors, because chiropractors are healers for the most part. Unfortunately, too many of them are becoming businessmen now, and they're bringing in a doctor for a day to shoot up a lot of people, and the doctor doesn't even know what he's doing because he's not injection based, he's not musculoskeletal based. He does not use an ultrasound for his injections on the major joints. And often the chiropractors are just using a nurse. And as an example, when I inject a shoulder, depending, it may be 20 or 30 or 40 injections, whereas the doctor they bring in who doesn't know anything, or even an orthopedic surgeon who does it, may give one injection, which is not going to work. It can't hit all the areas around the rotator cuff and in the joint. And if they don't have an ultrasound, they're not even going to get into the joint. It's almost impossible. I know it's the way we used to do it, and I found after studying for years, I take ultrasound courses at least twice a year with cadavers, so we can watch where the needles go. And it's almost impossible to hit the joint in the shoulder and the hips and the knees without using an ultrasound. So be careful who you go to, and be careful of these, I don't know what you call them, but these dinners and these luncheons where people show up and then the chiropractor does the talking to bring in people to get stem cells. It's given us a bad name, and it's making the FDA go crazy, and we have a year and a half or so, and there's going to be all kinds of rules that come up. Right now the FDA has a moratorium, but these places will be shut down.
So it's a seduction lunch or dinner, so beware, people. You've been listening to Pain Free. Thank you so much, Dr. Darrow, for a great show. Thank you, Alex. Thank you, Nick, and everybody here behind the scenes at Living Pain Free. I'm your host, Nita Valens. Remember to listen to The Pet Show with our friend Warren Eckstein from 11 to 1 every Saturday. We're here at 1 o'clock again on Saturdays, and we'll see you next time.